Monica.
Hi, thank you
Hi.
for having me.
Yes. Well, thank you for being here. I
My
really appreciate
pleasure.
it.
My pleasure.
So, why don't we start out by you introducing yourself and then just sharing whatever you feel comfortable about why you started ketamine infusion therapy with us?
Okay, so I have been in recovery from addiction, alcoholism, sober, uh, miraculously over 12 years. But I've always had mental health issues. Um, and I've been hospitalized and in and out of the hospital while I'm in recovery. And I've been on medications, and it always seems to go back. It always seemed to go back. I won't say it
Mhm.
seems to now, but it seemed to go back to the same old, where I found myself in the same hole, and I couldn't get out of that hole.
Mhm.
And I was suicidal. I was finding myself wanting to die. I was having suicidal thoughts. I've done ECT treatments, which really zonked me. I'd say they did not help, but it was
Mhm.
part of my journey, I suppose. Um, but a friend of mine recommended this, and I spoke to my sponsor in my 12-step recovery program, and she said, "Why don't you try it?" She was supportive. And what did I have to lose? I couldn't have gotten worse. Like, I was pretty much, I don't want to, like, I'll just live out the rest of my life miserable. So I tried it. So that's what brought me here. It
Beautiful.
was highly recommended by a friend of mine. And at first I'm like, maybe for you, but not for me. I'm in
Mhm.
recovery, but okay.
And
That's,
how was that for you? I guess, with that stigma of being in recovery, that was probably a difficult transition to say, oh, let me use a psychedelic, another medication
well, that was
for
my
my
big
healing.
fear. That was my big fear. Like, what are people going to think? Or is this a relapse? Because it's a drug, but I was taking drugs anyway,
Hmm.
medication. Some
Right.
people, s- and this was medically supervised. And I was reading that this was real. Even my pharmacist recommended it. He said that these treatments were very good for mental health, and it really
Hmm.
helped people that were medication resistant. So I was thinking, maybe I just won't tell too many people. I'll tell my sponsor. And
Hmm.
and at first I was very thinking that I was doing something bad, like it was a drug, like a street drug.
Hmm.
But it's not. Like ketamine, it's not like I was snorting ketamine in a club, the white powder.
Right.
This is what I've come to understand, and I did so much research, is an IV infusion that's an anesthesia that isn't addictive in that
Correct.
form. So it's
Hmm.
non-addictive even. So I was concerned also about like the nausea, and I was scared, like, oh, what if I have a bad trip? And then, you guys at the clinic were so amazing. Like, I remember talking to, I think it was either Megan or Callie, and they said, there's no such thing as a bad trip. They're all journeys, and whatever comes out needs to come out. So I was really scared about that. Like, what if something, what if it's terrifying? So it wasn't an easy decision to make.
Hmm.
Like, I was thinking, am I going to be like one of those people in the program that, like, oh, I'm doing ayahuasca for spiritual enlightenment? And no, I did this because my mental health was really suffering,
Yeah.
and I couldn't break through no matter what. I couldn't
Hmm.
get well. And I feel like this with the integration has changed everything for me.
Yeah, it actually quieted down all those little negative self-talk, the ego, all that stuff. It just got rid of it, and you were actually able to do the work.
Yeah, and I forgot about this, that little voice that I heard every single day of my life. I can't, I can't, I can't, I can't, I can't. And I'm glad that we're talking about this, because I haven't said that once since I had that infusion where I realized I can do anything.
Um,
Like, what happened in my brain? Like, something shifted in my brain. Suddenly I know that I can do anything. Suddenly I know, I used to think everybody hated me and people were laughing at me. Those thoughts are gone.
they were all made up to protect you. You know, our subconscious is there to protect us, but sometimes it doesn't. After a while, it hurts us. I love that. I love that for you. What was probably the hardest process in the infusions, like when you started the induction series?
Um, well, it's a commitment, so I needed to get a good friend to drive me here because
Hmm.
you don't drive that day. So I felt like I didn't want to bother anybody. And, that whole I'm a burden thought process is
Hmm.
also gone now. Like I realize now that if someone offers to do something, they offer because they want to.
Yeah.
I'm not a burden. Why would I be a burden? But I couldn't get that all these years. Like the self-hatred that I felt my whole
Hmm.
life. I'm 64 now. And even like when I felt good, like I would look in the mirror and I'd be like, okay, you look good. Everything's fine. And I'd walk away, but I never really felt good about myself. I never really felt comfortable in my own skin. And I was always thinking people are talking about me. Psychotic thoughts, I guess, but I don't think those thoughts anymore.
Beautiful.
Yeah.
I think it's
Yeah.
probably the most transitional, probably for you, is just having those negative thoughts be quiet.
Yeah. And to say that I actually love myself today for the first time ever, you know, I remember talking to you and um, you're like, well, do you accept yourself? And I'm like, I do. Well, then you love yourself. So it's like that simple. Yeah. You know, I initially did the 6 infusions and thought that I'd be okay. Like, I'm going to be one of those people that's never going to need a booster, and I didn't want to have to do a booster. And I started slipping, I remember. But also said when I was doing it, I'm going to do therapy and I'm going to do therapy along with it. And I didn't. So I slipped and slipped and slipped. And I came back and we started working together. And the
Mhm.
therapy, along with the ketamine, and I'm consistently doing the exercises that were so hard to do, to look in the mirror and say, I love you, Bonnie. I love you, Bonnie, 20 times every day and pick 2 things that I like about myself every day. And then I realized, oh, the things I like about myself aren't just the outside stuff because I thought my whole life I am this. First, it was the weight, then it was the wrinkles, and then it was like all this, but I'm so much more than that. I see that I'm creative. I see that I'm kind. I see the things in me that people always told me, but I couldn't recognize because the other negative thoughts were so overpowering
Yeah.
that it's almost like walls in my brain. Like I almost felt my brain being rewired when we did the ketamine. Like I just felt like things moving around in there. And it's like those walls were broken. And now I can finally get to
Do
I can
whatever.
like I
Whatever.
knew why did I keep binge eating? Like, well, I'm hurting myself or I'm not wanting to feel something. But now I'm like I can actually think before I start to eat garbage and say, I don't want to hurt myself. I like myself. Like that's amazing.
That is transformative right
No
there.
pill ever did that for me. Ever.
Hmm. I love that for you so much, Bonnie. I'm
I
so
know.
happy. You have
And you
no
guys have been
idea.
so supportive, because you need a safe environment to do
Hmm.
this in. I don't know that I'd be able to do this in a place where people were just like, here, here's, let's take your blood pressure and put you in a room and, you know, see what you need to see. Like we processed. You talked to me before I did the infusion. You understood where I was at. Like
Hmm.
that's your little girl that's saying you're not good enough. And then my first infusion, I'll never forget. I was like a superhero climbing these steps, and I had my hand back, and that was we processed after. I was holding that little girl. My
Yeah.
little child saying, I've got you. I can do this. And then ever since, that voice of I can't went away because I know that I can.
Yeah.
But you helped me process what was going on before and after.
Yeah.
I think that's
That's
really
very
important.
important.
Very important.
Hmm. Yeah, because most people, and we have it, and just like you said in the beginning, where you had that transformative experience with the medicine, but without doing that work, it hasn't been sustainable, right? Just outside without the medicine. So now that you're doing the work, the integration, the coaching, we're working together, you've been doing amazing. So now we're like spreading out. to hopefully now we're going to go and maybe monthly infusions or every 6 weeks. We're kind of like in that tapering process. So we were at the 3 week taper, but she's been doing so well that we were actually going to prolong and try to hold off for 4 weeks and see how she is at 4 weeks if she needs it. If not, we'll go to 5 weeks, because everybody's different,
Or once
right?
a year, twice a year, 3 times a year,
Exactly.
whatever it needs.
Yeah.
I will do it. I was thinking I wouldn't do it, but it's not something that I look forward to doing. Like, oh yeah, I can't wait to get an infusion. Yeah, I can't wait to see the psychedelic lights.
Mhm.
No, it's not like that. But I will do it because I know that it helps me process things that I couldn't process without the infusions.
Mhm. Yes. But also keeps the little Bonnie at bay and quiet and
Yeah,
knowing that she's not going to come out and win the arguments, right? All
exactly, exactly.
right. Can you share any specific changes or improvements in your mental health that you noticed in starting the infusions? I can know we touched on that a little bit, but anything specific?
Well, I notice myself when I'm doing any self harm activity, like I tend to pick my cuticles, so I would stop that. You know, um, I can stop myself now, whereas I couldn't. And I also have to say, because my recovery is so important to me in from addiction, and I put that first, and I love that program, 12-step programs. I'm all for that, because without that, I wouldn't have gotten here.
Mhm.
But it says, in the literature, it says some people need outside help. And I believe I'm one of those people. And yeah, that's definitely been a concern of mine. Like, I tell people now, I'm not afraid to tell people, because if they don't agree, that's fine. But for me, for my program, it works for me. This is what I need to do to keep myself okay. Because, there's 12 steps. We work the steps, we change, we have entire changes from working those steps. But still, sometimes I couldn't, I kept falling. I kept falling and falling. And I was helping people. I was speaking in treatment centers. I was sponsoring people. So I really believe that this is a mental health issue
Mhm.
separate from addiction for me. Um, and I do believe that I was able to get to the real root of what was making me do these self-harm activities. And I couldn't get to the real root before. This somehow changed the something in my brain, right? Isn't that
Yeah,
what it does? It changes the
it
chemistry,
does.
and it opens new
Yeah.
neural pathways so you can think differently. And I'm not thinking the way I used to think. Things that would have upset me don't upset me anymore. People that I used to think, what are they thinking? I don't care. I really don't care.
And you don't need to care.
And I
And
don't
that's the
need to
beautiful
care.
part.
I just need to be kind and take care of myself, and
Yes.
all else will follow. I'm being more creative again. I'm very excited.
Well, and that's the beautiful part. Now you're doing the work. You're doing things that make you happy. You're actually scheduling that in. You're prioritizing that, and then continuing to do the work to keep those negative thoughts at bay,
And
and they
that's
don't even
because of the
emerge.
integration.
Hmm.
The ketamine itself didn't do that for me,
Right.
because it helped. But if I wasn't doing the work, I know what happened the first time when I got the infusions and I wasn't
Hmm.
doing the work.
Right. Yeah. So that's a beautiful lesson learned. It's like ketamine is an amazing catalyst, but doing the work along with this amazing medication is what gives the long lasting benefit. And here we are, you know, at 3 weeks where she doesn't need her maintenance infusion this week. And we're going to prolong it and we're going to actually go to see if we can do 5 weeks. So
Yeah.
we'll do that. But continuing the coaching, we regularly talk to each other and coach.
Like, another thing, for the past, I'd say in 7 years, I've taken one trip, and I went with a friend of mine. We went to Colombia, which was amazing. But I've scheduled probably 5 other trips that I couldn't go on, because I just couldn't do it. I'm like, I can't, I'm not okay mentally. And I was excited about making a trip to New York to meet some friends. And I thought about it, and I'm like, no, I can't do this. And we talked, and I realized what were my fears. And yes, I can do this. And I'm now asked, what were my fears? And yes, I can do this. And I'm now actually excited. Like I'm able to turn my thought process around so much easier now. My
Yeah.
mind is open to seeing things that I couldn't see.
And receiving it as well.
Yeah.
That's amazing. Yeah, because you have good friends in your life that have, always been there to support you, but sometimes you weren't open and available to like listen and just to be aware of like all the stuff that they were, trying to help you with,
I
right?
didn't believe anything anybody
Yeah.
said. I
Yeah.
really didn't believe that my best friends cared. I didn't believe that my husband cared about me. I didn't believe that, you know, I think it's that I thought I had borderline personality. Like I'm able to turn my thought process around so much easier now. My
Yeah.
mind is open to seeing things that I couldn't see.
And receiving it as well.
Yeah.
That's amazing. Yeah, because you have good friends in your life that have, always been there to support you, but sometimes you weren't open and available to like listen and just to be aware of like all the stuff that they were, trying to help you with,
I
right?
didn't believe anything anybody
Yeah.
said. I
Yeah.
really didn't believe that my best friends cared. I didn't believe that my husband cared about me. I didn't believe that, you know, I think it's that I thought I had borderline personality disorder where like one thing would go wrong and I'm like, they hate me. But all their behaviors and actions towards me showed me that they don't hate me. They care about me, but they hate me. I'm done with them. Now, like if I get that thought, I'm like, wow, they don't really hate me. What am I thinking? And I've heard that there's a therapy called DBT,
Hmm.
dialectical behavior therapy, which for years I've been saying I want to do. And then I remember signing up for one group and I was in it. And I woke up one morning and I couldn't make it there. And they kicked me out of the group. I couldn't follow through with it. And suddenly, and that was a therapy that takes months and months and months.
Hmm.
And look, I've been doing this for a very short amount of time. And suddenly I'm turning my thoughts around that DBT teaches people to turn around in a long amount of time
Yeah.
with medication. And I'm lowering my medications as well.
Yeah. Beautiful. With the help of a psychiatrist. I definitely
Absolutely.
don't ever recommend it without doing that.
Absolutely.
Yeah, so that's
Absolutely.
beautiful working with your doctor and that. How would you describe let me go through here. Okay. So I'll just start. This is the pause area, Megan. All right. How would you rate the level of support and guidance you received here at Ketamine Wellness Clinic and during your integration sessions?
Yeah, everybody was so kind because you know, I felt very helpless when I first came in. I felt really helpless. And then when I was leaving, I was a little dizzy, but everybody talked to me. Everybody was, they shared their personal experiences with me. Um, I was just treated with kindness, and that really makes all the difference in the world. And I could tell that you guys here really do care about people. You're not just doing a job. Everybody in here really cares, and it's nice. Like I don't hesitate if I need to text you about something. I don't hesitate to text you. In the past, I would have been like, I'm bothering her, and no, um, yeah, from the minute you walk in, even my friend who drops me off, he's like, they're so nice in there, you know?
That's beautiful. And I think it's important because you're coming in to do something that makes you very vulnerable. And a lot of people coming in get a little nervous. I think the first appointment is probably the most nerve wracking, right?
I was so depressed. I remember, my God, I don't even feel like I'm the same person anymore. It's like when I think of how I used to drink and drug and all that, like I can't believe that was me. I can't believe that I was so depressed and that I couldn't find a way out. No matter what I did, I couldn't find a way out of that depression. But I'm not stuck anymore. And I did have one experience where I felt like I was like in this, everything's twirling and you're like in a kaleidoscope, and it
Mm-hmm.
was like I was stuck in this mud and I felt like I was dying. And then one of you said to me that it's like it's the death of the ego.
Mm-hmm.
And I think that a lot of it has to do with the ego, a lot of all
Yeah.
that self-centered fear. People are looking at me, people are talking about me, and I do believe that that's what happened. So
Mhm.
it wasn't a bad trip. It was uncomfortable. That was the only infusion to me, I think, that was uncomfortable for me, because in the end I was like, it was not feeling, I was like, am I dead? And then I realized, oh yeah, the reason that that happened is because I realized I had an epiphany. Each one I have an epiphany. One was um I don't have to lose weight. My whole life I have to lose weight. No, I don't have to lose weight. People do care. um uh I don't want to die. And if I don't want to die, I want to live, and I want to live the best life I can possibly live. How am I going to do that? How can I do that? So each epiphany was amazing. Like, I can do anything, so that I can't run away. So it's like I have epiphanies each time I go under,
Yeah. Even if it's just to be unstuck.
just to be unstuck. Yeah.
Yeah. Yeah, that's the beautiful part. I usually don't tell patients that they're going to have a death experience, because then it could be fearful, right? I'm sure
Uh-huh.
you would have been terrified knowing that ahead of time. But once it does happen, how did you feel like in that emerging from that
I
experience?
was happy to be awake, and then as I processed it over time, I realized what it was. Like, yeah, it is the ego. And I've listened to so many podcasts about ketamine and all that, and they always say that it's
Even if it's just to be unstuck.
just to be unstuck. Yeah.
Yeah. Yeah, that's the beautiful part. I usually don't tell patients that they're going to have a death experience, because then it could be fearful, right? I'm sure
Uh-huh.
you would have been terrified knowing that ahead of time. But once it does happen, how did you feel like in that emerging from that
I
experience?
was happy to be awake, and then as I processed it over time, I realized what it was. Like, yeah, it is the ego. And I've listened to so many podcasts about ketamine and all that, and they always say that it's about the death of the ego that
Hmm.
allows us to get well, because the
Yeah.
ego is really,
It's that story that we just hold, and egos aren't necessarily bad. That's who we are. That's who we identify. That's the ego kind of lays in the front of the brain. So it's who we are, but there's also the subconsciousness of who we are and what we can become and what our capabilities are. And our ego also protects us, whether it's good or bad, it protects us. And those is where those negative stories lie, you know. So having that ego death, the symbolic experience of that really allows you to really grow. And then, what do I want to be now?
yeah,
Who
like,
do I want to be? Who am I?
yeah, like, I can't leave the house because people are looking at me because I look fat. That's like, okay, you can leave the house, but yet I knew this, I knew it, but I couldn't, I couldn't really break through it.
Hmm.
Just because you know it. Now it's like, okay, that's a ridiculous thought. Like, I'm so much more than the way I look.
Yeah.
You know, it doesn't mean that I don't care about the way I look. I do. I want to look the best I can look, but realistically, I'm not 20 anymore. I'm not Barbie. I'm Bonnie. Bonnie's better than Barbie, right? Because Bonnie's real,
Exactly.
Barbie's not real. And yeah, to accept myself for who I am, where I am in my life, is a big, big deal.
Yeah. Because you're never going to be anywhere else except for right here,
Yeah.
right now, at this very moment.
Yeah.
Yeah. And just really being able to appreciate that. That's the beautiful part.
And appreciate life, and wake up and like look forward to, now I have this thing which people have been telling me for years, you do too much. Pick three things. But yet now I can say, okay, I couldn't do certain things. I kept, I can't. Now I can. Okay, I've done enough for today. I had a good day. I'm a good person. It was a great day. Like,
Yeah.
nothing is a big deal anymore. Everything was such an ordeal, such a big deal. Now nothing is a big deal. Nothing. If I think it's a big deal, I can process it and I realize it's not a big deal. I'm so much more laid back. When you talk, people talk about psychedelics in the 60s and laid back, and you think it's all because they're wasted on hallucinogenics, and but I know that feeling now of just like nothing's that big of a deal, and I don't walk around wasted on
Yeah.
hallucinogenics.
Yeah.
That experience is what, 40 minutes
Mm-hmm.
of an infusion that you have that hallucinogenic
Right.
thing going on, which you know, to me isn't the most fun part of this at all. I will be honest. Yes, it's interesting at first. I was like, wow, this is like a movie, but it can be a bit overwhelming, but it's when you leave, you see that your brain kind of like with all those things, your brain, I actually many a time have felt things opening in my brain. Like I felt my mind expanding. I know it sounds
Yeah. No,
crazy.
I think in one of the experiences you actually described that it was like you felt the rewiring and everything there.
Yeah.
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 And actually saw it and noticed it. That
Yeah.
was really cool. Very, very cool.
Yeah, my
Did you?
biggest fear was the recovery part.
Yeah.
That was my biggest fear because I'm in recovery, and I take that very seriously, and I know that there's a lot of people out there in recovery, and that's why I was thinking about writing another book, because like there's so many people that are so against even taking an aspirin. Like we don't get sober to suffer. Like an aspirin is going to just make my headache go away. If I have mental health issues, like if I'm doing this because I want to feel good and expand, I don't know about that. I know for me personally, it was because I was at a place where I kept finding myself in a hole and I couldn't get out. And this opened that up. But it isn't like a drug that I relapsed on that I want more of. Like, give me more
Right.
of that. It's not like it's something that helped my mental health, and I'm not ashamed of it anymore. Um, I've told people, and if they don't agree, it doesn't really matter. I don't
Mhm.
agree with what everybody else does either. I don't talk about it in meetings. Oh, by the way, I did ketamine infusions, but I know a lot of people that have, and yet I know a lot of people that haven't. And I know people also that have stopped taking their regular psych medications because people are like, you don't need medication, you're in the program, you're sober, and they've committed suicide. Just
Mhm.
because I'm sober doesn't mean that I'm sane. I could do the work that I need to do in that program, but you know, people that are suffering with heavy depression that are in recovery, like why if you don't have
Mhm.
to?
Right.
If you don't have to suffer?
I mean, there's so many different histories and like reasons and why people become addicted, whether it's genetic or social, family, coping, mental health, just society in general. There's so many reasons where addiction occurs, but a lot of it has to do with mental health. And then afterwards, even in the recovery process, when you are clean and sober, there is still mental health,
Hmm.
that people have to overcome that will help in the recovery process. I mean, you were sober, but then you still struggled for many years with the mental health.
Many years, and I've been on many different meds, and some of the psych meds made me so sick, shaking and awful, awful. And nobody really knows. Like psychiatrists really don't know the brain.
Hmm.
They don't know. Well, maybe this will work. Maybe this will work. Try this. Try that. And I have a friend that called me. He's probably he got sober at 15, so he's probably 30, 20 or 30 years sober, and he has mental health issues. You know,
Hmm.
and he's like, I'm afraid. What if my meds stop working? Like I'm like, there's always going to be hope. Like this has helped me because I shared this with him. I'm not recommending to everybody go out and do it, but if you're suffering and medication hasn't helped, for me, it's been a lifesaver.
The watching you transform from that first appointment to where you are today has been beautiful. I'm very
Thank
excited
you.
for you
Thank you.
of all the possibilities and your trip to New York.
Yes, I'm very excited.
So happy. Were there any unexpected or surprising aspects of the treatment that you'd like to share?
So I didn't realize that it was, like I said, not an ordeal, but it was, I thought, oh, I'll just do some, you just go in 1, 2, 3, bingo, you're out. It's not like that. You like I would stay at my friend's house. He would drive me in the morning. He'd drop me off. I'd sit here, talk to everybody, share what was going on. So it's like therapy. And then the IV, which is always a lot of fun, getting a needle in your
Right.
arm. Maybe for some people, but not for me. And then, you have the music, and Julie's meditation is always phenomenal.
Oh,
Like I
yes.
listen to that sometimes at night, just when I'm relaxing. Um, but you do the meditation, and then um, the first time, like I remember, what's so great is that you guys said that the salt lamp would be on, so I
Mhm.
know that it's over, and I start feeling like my fingers and toes again. I didn't realize how out of it you really were for those
Mhm.
45 minutes. You're awake, but you're really out of it. And then you come
Right.
out of it and you're like a little wobbly. And then sometimes it takes a few hours to adjust
Mhm.
to that you're not like feeling almost like high in a sense, which I was like, one time I came out, I'm like, oh God, drugs are great if they're prescribed by a doctor.
Right.
But then then I'm like, no, I don't like this. I don't want to feel that anymore. Like
Right.
I want to shake it off. I want to
Mhm.
just be me again. So it is a whole process. You it is a whole like ordeal for a day.
Right.
It's not like,
Yeah.
yeah, let's just go do some let's go for some drinks and be done with it.
Right.
No, it's not that. It's a medical procedure.
Mhm.
For me, it's been a growth experience.
Yeah. Yeah, because even after the infusion, and that's what we always try to tell with patients. And then for you, after the infusion, you're supposed to spend the day self love, self care, not go home and then all of a sudden have to take care of your kids or all these dogs, like all these projects. No, it's supposed to spend the day just reflecting, journaling, doing the work,
Journaling really
and just
helps.
being,
And I'm sorry, I love that you guys offer, once a week, Monday night, to connect with other people that have done the ketamine. So
yes,
it's for life, so you're connected. It's not like you're off on your own, because had I done these on my own, left to my own devices, it would have been, now what? You know what I mean? I don't know. But
hmm,
you can process, you can ask questions, and you can
yeah,
talk to other people. How often do you need a booster, or what has it done for you, or how's it helped you? And because I could tell you most people that I know have not done this. I know
right,
two people that have done it, but it's good to have a support group of people that have done this,
hmm,
that if I have a bad day, I'm not suddenly like, oh my God, I'm going back into a hole, a bipolar. No, you're just having a bad day.
yeah.
Just give it a chance, like, yeah.
Yeah, and I think that's a big part too is just knowing the cycles. And I tell everyone, you're not going to have a 10 out of 10 day every day.
Hmm.
It's a normal cycle. When it's raining or storming, our moods go down and up, and it's a normal fluctuation. And so it's really learning and, having those coping and being able to have that communication with yourself, knowing that these cycles are normal, knowing's up and, it's just life.
Hmm.
And then men think, oh, well, we don't have cycles, but men also do have hormonal cycles just as women do. It just may not be as like apparent, but moods drop and it's always fluctuating. And, just having that communication and being tied with the group and evolving on Monday nights and grouping together, being able to share experiences and having that connection. It's always good to always stay in that conversation. And I think that's really good with AA, that you have those regular meetings and you have the communication and conversations in that aspect. And that's why we do offer, the groups on Monday nights, for life of the, once you become a patient, for life, you can join the group,
Yeah, it's support. And I will say, Sonia, that you really have been, like,
Mm-hmm.
you're an anesthesiologist that started this because you wanted to, right? A nurse
Mm-hmm.
anesthesiologist, you and Callie wanted to help people. You
Yeah.
really do. And I get that. And you got me. You were able to read me, and I feel like you understand me, and I'm so grateful for all you've done. Really. I mean,
Oh, thank you so
I'm sure
much.
she doesn't need to put this in. I'm sure she probably won't, but whatever. Like, you've made a difference, a huge difference. I'm so
Thank you.
grateful. So
Oh,
grateful.
thank you, thank you. I'm so
Yeah.
happy that
And
you're doing
there's
amazing.
places, yeah, people are like, why do you have to go to Pompano? Like, isn't it, because I live in Aventura, so it's like 45 minutes to an hour in traffic, but I'm comfortable and safe here. Maybe there are other places, but I
Mhm.
know that you guys here have helped me. So it's worth the drive. It's worth it,
Oh, thank you so much. I feel honored that you
Remember
come
at the
and see
beginning,
us.
I had to cancel because I wasn't well.
Yeah.
This morning I woke up, I'm like, oh, maybe I don't feel good. I had been having vertigo, and I'm like, no, 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 I want to go. I said I was going to go. I'm going to go. I want to go. I can do this.
And you did it.
And I did it. And here I
Yeah.
am with
With
her.
Luna. Luna. Aw. The mascot.
That's what
Perfect.
Michelle.
All right. Well, thank you very much. I
Thank you for
love
having me.
you.